Next, let's talk about our resources and supplies for compounding a large volume parenteral. So the essential supplies, most of these compounding procedures require the same types of the supplies, and we'll find most of them in the anteroom and the clean room. For the anteroom, your supplies include a calculator, your aseptic garb, pre-saturated aseptic cleaning wipes, a waste container, excuse me, and various other compounding supplies. So your procedure-specific supplies. To produce a large volume parenteral, generally you're going to need a vial. So a vial is a sealed, sterile container that has a rubber top by which we draw out the fluid. It contains medication either in a powder form that has to be dissolved with a liquid diluent, or it will be in a liquid form. Because a vial is a closed system container, an IV technician uses the milking technique to easily and safely release the negative pressure within the vial. So that's why we inject air, adds positive pressure to the closed system, and then we let the plunger come back and the fluid come out to equalize that pressure. That's called the milking technique. So we push up and let some air into the vial, then we let go, let the liquid come into our syringe. Then generally we still have to have a little bit more air in there. We push a little bit more air into the vial, we let more liquid come out, and we might do that a few times. That's called the milking technique. Also, by trying to keep the pressure equalized and not put too much pressure into the vial, doing milking so that we don't put all that pressure in at one time, it helps prevent aspiration or spraying or leaking out of the vial. Another concern is coring. So as we discussed, coring is when you cut a piece of the rubber stopper. So it gets torn off and it can actually contaminate the solution. So we want to make sure that we insert that needle at a proper angle so that we can just kind of cut a slice through that rubber diaphragm without cutting a hole into that rubber diaphragm. Also, we're going to need a large volume base, our IV base. So most commonly, the IV bag, it comes as a flexible plastic or a polyvinyl chloride or PVC bag. Now, the large volume parenterals, the injection port may be on a tail, as it is with this bag on the left, or it may be a what they call a nipple, which is, we also kind of commonly refer to it as a belly button injection port on the front of the bag. So the button or nipple injection port can be found on the bag's face, where the tail injection port, which is the most common, is at the bottom of the bag. Before beginning the IV, make sure that you think about where are all the critical areas. So we have to make sure that we don't obscure or obstruct those critical sites through touch contamination, shadowing, or incorrect placement of the item in the hood. So we have to be aware of the placement of everything, our hands, other items in the hood. So we can't block anywhere on this critical area. So as we're looking at this whole piece all the way down to the syringe tip. So we can't block with our fingers anything that would be in that space. We also can't block anything in this space once that plunger is extended out from the barrel. Now there's a slight area at the bottom where we have to be able to have some leverage for our fingers. The blue is okay. The blue is okay. We can touch that barrel wherever we need to touch that barrel. Also, we need to make use of that collar for leverage. So that collar is very, very important. So yellow area is no, blue area is okay. All right, I'm trying to get get back to, there we go. So preparing to do a large volume parenteral, the ante-room procedures, the first thing we do is verify your label against the medication order. We want to check and make sure we have the right patient. We want to make sure that we have the right amount of medication that matches on the label to the order. With a large volume parenteral, we're also verifying our base solution, not only the solution itself, but the volume of the solution. We're looking at the flow rate. So we're going to need to look at all of that. Then we're going to do any kind of calculations. So once we verify, we're going to then take our label and our medication vial, and we're going to calculate how much we're going to need. Once we do that, that helps us identify what size syringe we're going to need, if we're going to need more than one vial. So then we're going to gather all of our supplies. So our supplies include a syringe, a needle, our alcohol swabs, and our medication vials, as well as our base solution. So we want to gather all that. Once we gather all that, then we need to clean them. So we're going to clean our basket first, then we're going to wipe down all of the items that we're going to bring in and place them in our basket. Then we're going to go ahead and do our garbing and hand washing and putting on our gown. The clean room procedure, once you go into the clean room, you're going to sterilize your hands with the IPA foam and then put on your sterile gloves. Then we'll clean the hood. So, we're not going to clean the hood in practice every single time. We'll just pretend that we're making an additional item after the hood's already been cleaned. Now this diagram, it's important to look at when we're looking at the placement in the hood in the zone of turbulence. So I know back in chapter 2 we kind of talked about it. So here we have the HEPA filter, so the air is being blown through and it's coming out. Of course, this area here is the clean air, first air, closest to the HEPA filter. But we have to be aware that when this air flows out, when it hits an object, it gets pushed off to the side. So anything in this area is no longer clean. It's been obstructed by that air. So that anything that's placed behind in this area would be shadowing. Now that even means the side, because it becomes turbulent. Once it hits the edge, it kind of bounces back and forth a little bit. So if I had to place another item into the hood, I would need to think about also the zone of turbulence about the item that I'm placing in the hood. So if I'm placing something here, my zone of turbulence would be fine, and then it would come out. So I need to make sure that these two areas are not overlapping. I need a free zone to keep everything placed properly in the hood. When the small supply items are arranged in the outer 6-inch zone and the large supply items are placed in the DCA, then you're ready to begin your compound. The first step, your base solution is generally in an outer dust sleeve. So you're going to hold it over the DCA and open the sleeve, remove the bag, place the bag on the DCA, and put the outer sleeve dust cover either in your basket or in the garbage. Then we'll go ahead and place the rest of our items. All right, your turn. This is used to continuously deliver an IV medication to treat a specific medical condition. That would be an IV drip or a drip solution. This is an undesired event that occurs when a needle is inserted incorrectly into a vial's rubber top. That would be chlorine. Okay, some additional questions.